So tell me, what is integrative medicine?
Integrative medicine is now actually considered a specialty in which we have certain precepts that we believe in, which one of the main ones is that instead of only looking at people's diagnoses and their physical body, we think we need to know who the whole person is. And so that means their physical health, but also how are they mentally, emotionally, spiritually, what is their environment, what is their community, because all of those things impact someone's health and wellness, and that's what we focus on.
So in your specialty, you take care of the whole patient. How do you have time to do that?
Well, one thing is I have a team, so I spend more time with patients. That's the other thing that Integrative does. We do not have 15-minute office visits. We have longer. We see new patients for longer. We get to know them. We have an intake that asks a lot of questions about what are the things that are important to you, what stresses you, how is spirituality important to you, what is your purpose in life, more than just the review of systems and your past medical history. We have a team, and that team is also a dietitian who's going to look at their nutrition.
So dietitian, look at what they eat and how much they eat and how often they eat and when they eat and what's that doing to their activity, their energy level?
Absolutely, because food is medicine. So what we put in is what's going to determine how we feel. Also, then we have an acupuncturist.
Acupuncturist. So what does the acupuncturist do and how successful are they in your case?
We think our acupuncturist is very successful. Acupuncture is a different paradigm, right? It is considered a traditional medicine along with Ayurvedic, but so if you look at evidence-based studies in Western medicine, I think the top three that you would know that acupuncture would help with is arthritis of the knee, back pain, and probably nausea and vomiting with chemotherapy, but also migraine headaches. We can actually do a lot for allergies, believe it or not, at acupuncture, and really the VA now uses it tremendously for post-traumatic stress disorder, so we use it a lot for that as well, yes.
So who's another one that's part of the team? So we have
a psychologist.
Psychologist.
Who, it doesn't have to always be a psychologist that does mind-body work, but she is cross-trained in so many areas. Energy medicine is one thing, right? And we could spend time on all of these individually, but she knows about different personality, if you want to call it inventories, how it is that we see the world. So we use the Enneagram, it's called the Enneagram a lot, to help people understand themselves and the myths that they might be living with and their relationships. She actually trained in aromatherapy, so we use essential oils, so she can teach people about that.
And these things can help somebody be more energetic, be more active, more mentally active, physically active?
Absolutely. The other piece, though, that's really important is the piece about meditation and mindfulness. Because a lot of times our perception of pain increases depending on what the circumstances are around us.
For instance?
For instance, if I'm having a really bad day, the pain that I normally might have in my knee or my ankle could be significantly increased because of the way I'm emotionally responding to what's going on. So a lot of what we try and teach people is to be able to separate the emotional response to something and be able to just see it as separate from you, right, as the person. Also, a lot of times people somehow begin to hate that part of their body that gives them pain, and we find that is not useful to people. They have to realize this is part of me, and I have to learn to accept that to a certain extent and then work with that, right? So when we talk about mindfulness and meditation, really what we're talking about is being aware of what your sensations are, but not going down the rabbit hole of feeling them and going into all of the worry about, oh, I'm hurting and this means I can't walk, and that means that in 5 years I won't be able to do the things that I want to do.
It goes on and on
yes,
and on in
then
a negative pathway.
And it makes it worse, and it makes that moment of experience worse as well.